Okay, so hello guys. So we'll be starting with our the next speaker. So our next speaker is Dr. Aniruddh Agarwal, who would be speaking on what are the various opportunities for doing research. So Aniruddh Agarwal is an intern at Nair Hospital. He has already published 17 papers in peer-reviewed journals, including Journal of Cellular and Molecular Medicine, Spine Deformity, the official journal of the Scoliosis Research Society, and Clinical Orthopedics and Related Research, that is CORR. Then he has already performed a workshop for 160 plus students and has founded PubGeek, a platform to allow easy entry of students into the field of research. So over to Dr. Anirudh. The floor is yours, sir.
Thank you very much. Thanks everyone for being here today. I know it's been a long day, the first day of the workshop. But I just want to introduce you. A lot is spoken about, how you're going to write your papers and how you're going to actually have innovations and patents and whatnot in your research papers. But a lot of you may have the question that, well, where do I even start your research, right? So I'm going to talk a little bit about the common things. Excuse the layouts. It's this webinar jam scenario where the layout's not proper. So there may be some layout difficulties during the presentation, but if you find any, we just ignore it. Right. So an interesting fact is that German medical students must actually complete a research project in order to receive the title doctor, right? And it's actually surprising that in the Indian scenario our curriculum at least doesn't give enough importance to research, and and that's what we're trying to do. PubGeek as well as IMA, MSN, and all the other UNESCO bioethics cell and everyone that's involved in this particular workshop is trying to get more people into research. And so when you're looking for opportunities associated with research, right, you gotta ask yourself where your interest lies. Like uh, the sir before me said, um, sorry, Dr. Giriraj before me said that he went from bed to bench and then tried to associate bench to bed and come up with ground level studies that would change the way doctors would practically or clinically treat patients, right? So it really depends on you where your interest lies, whether you want to be in a library-based research setting or you want to be in a clinical-based research setting. So library research is also called wet research, where you're actually trying to use lab equipment. You're talking about when you're talking about genes, when you're talking about specific proteins, when you're talking about protein pathways, molecular pathways. Um, you're talking mostly about laboratory research, right? And when you're talking about clinical-based research, you're talking more about, say, intervention of a particular drug on a particular disease, or you're talking about whether a surgery is good enough for this pathology or it's not. So you really have to determine one of these sectors because you can't do both. However, you can influence one and the other, like Dr. Giriraj said. Your laboratory-based research can lead to clinical implications, and your clinical implications may lead to some new sort of causation that you found that needs laboratory-based evidence, and therefore you are trying to use both. So when you're looking for opportunities, you should make sure that you know exactly what you're looking for in terms of these two. So another interesting factoid on the scenario of research in India is that in 2007, 96% of the publications that emanated from India were only from 9 medical colleges, right? And we have over 500 medical colleges in this country. So it just gives you an example of how some medical colleges do promote research, and some may not, right? So what we're trying to do is give an equal platform for people from all colleges to be able to at least start their own research or look for appropriate opportunities so that they themselves can become academicians later on in their career and know about research before they set into their clinical or lab field. Um, So the most common thing that medical students talk about, even from the first year of medical college, and the most common associated or research opportunity that we know of is the ICMR's STS, right? Short-term studentship. So what this basically is it's the Indian Council of Medical Research is providing you an opportunity to do research. However, this opportunity is not related to you learning anything from ICMR, right? What ICMR is basically doing is it's giving you a stipend of 20,000 rupees essentially for 2 months to conduct your research. However, ICMR does not help you along the way or does not give you step-by-step instructions on how you should actually perform your research and how you can go about finishing it and stuff like that. So what ICMR STS basically is that you have a research idea in mind. You approach a guide from your college or from some other college, an approved guide, and you submit your elaborate research protocol to ICMR. Then ICMR takes a few days to months. Then they tell you, okay, your protocol is approved. And after that, you're given 2 months, right? Between April and September, you're given 2 months, any 2 months that you choose between April and September to complete your research project and then submit it to the ICMR again for evaluation of your results. So essentially, the ICMR STS is something that medical students see as, the epitome of like student. I mean, if a friend gets ICMR STS, wow, wo to research hi karne wala hai. Wow, he's really gonna succeed in research. But that's actually not the case at all, right? Because ICMR is not helping you along the way. It's your guide who's helping you along the way, and that guide will be available to you irrespective of whether you get an ICMR STS or not, right? And the stipend of 2 months, however, you may not get. So how the stipend of 2 months also works is, um, you you like ICMR accepts your proposal, you perform the research, right? After that, when you submit your reports, your analysis of your results back to ICMR, and then they approve it the second time. That's when they give you this 20,000 rupees for the 2 months, right? So it's not that once you get an ICMR STS, you get 20,000 rupees and you'll be able to fund your research, right? You need some sort of capital to invest in your research beforehand, and then eventually you'll get that money back, right? And one more thing about the ICMR STS is that people giving final year exams cannot apply for it in next Jan. So suppose you were giving your final year exams in December 2021, sorry, December 2020, you cannot apply for the STS in Jan 2021, which is usually the date that STS starts. So again, how it works is one student selects one guide. It can be in any field that they want, microbiology to surgery to medicine to patho, anything they want. Complete a research protocol, usually by January. ICMR will evaluate your protocol, and it'll select only 1,200 MBBS, 1,200 MBBS students protocol and 300 BDS students protocol. And then they'll give you you select 2 months to do it between April and September. You submit your report by October, right? And if approved, then you get a stipend and certificate. So this is just an example. This is just the total number of medical students that are there in India, right? It's I know it may be a little confusing because of the layout, but it's 3,36,090, right? And the number of people that ICMR can help, as we discussed, was only 1,200. So only 0.35% of students can actually get that ICMR STS, which is, I think, one of the most common and one of the most frequently talked about research opportunities that are there for medical students. So what can you do besides this STS, right? What are the other opportunities that are there that you may or may not have heard of? So again, a lot of people before they want to head abroad for complete the USMLE, complete the ACFMG certification, go abroad for residency, whether it's internal medicine or surgery, and I'm sure you've heard of the term clerkships, right? Basically, clerkships are when you work in their department as, say, an intern, right? It's essentially an internship where you are allowed to, touch the patient, you are allowed to take history and stuff like that. But research clerkships are different. You are essentially working with their research department where you will be, going through a lot of literature. You'll be doing a lot of background literature search. That'll be your job. You're not going to be seeing a lot of patients like on a clinical basis. you're basically going to have to do a lot of background research, see what research projects they're already working on, see how you can maybe facilitate or expedite the process of those research projects that they already have, and then you will then after that, if you end up publishing something in those 4 to 8 weeks that you go for this research clerkship, then your name may or may not still be on the research paper, right? So a couple of research opportunities that are there in the US. The most famous one is probably the John Hopkins research elective. It comes, however, at quite a pricey fee, which is $500 is the base fee, which translates to 35,000 rupees, and then 3.5 lakh per 4 weeks, right? So unless you really you really are hell bent on going to the US and want to do research at John Hopkins, it's going to be a heavy, it's going to be well quite a expensive affair, right? Another option is King's College London, where it's slightly cheaper, actually a lot more cheaper, where the application fee is just 10,000 rupees and you end up paying just 5,000 rupees per week. So if it's a 4 week research elective that you're going for, it's going to be around 20,000 rupees, which is much more affordable than the 3.5 lakh price tag on the John Hopkins research elective, right? However, some people may not want to do this. They may not want to go abroad. They may want to start their own research locally. And therefore, we're going to talk about a few local opportunities that are there. So in the IIT Bombay lab, IIT Bombay, there's a lab called BETIC, right? Which is basically a biotechnological lab. And they have a summer course every year where they form teams of a programmer, basically a CS guy, a mechanical engineer, an electrical engineer, and a doctor, right? And they solve medical problems through integration of medicine and engineering, where they have teams of like 6 or 7 teams of these people working together. Excuse me. 6 or 7 teams of these people working together, and they have to choose their own project or they have to take from an assigned project. So I had the good fortune of visiting one of their sessions that they had conducted, where everyone would explain their projects and we would get to critique them. Where some examples of those projects would be developing, say, a filter in, suppose you're in Iraq, right? And you are basically in the midst of sand, and some soldier has a crush injury, so you have to maybe perform an amputation right there. So how are you going to do it if you don't have, say, an operating room that's clean? So it's basically about developing a filter where the air would be easily filtered, and you would have a small surgical area, let's say just on the leg, where surgeons would operate. Just 2 surgeons would enter that small chamber and operate. So this is just an example of one of the projects that they were working on. But there are quite a few interesting research projects that are going on that are not exactly clinical research, but they are amalgamation of your is everyone able to see me? If you guys can't see, then just please refresh your feed, and I'm sure you'll be able to see me, right? So yeah, is the moderator here?
Hi,
Hello.
yeah. I wonder like what should be the issue with some people.
Can we take
Um,
a poll? Can you see me or not?
uh, I guess guys, y'all can type on the chat box if y'all are seeing him right now. You can reconnect as well if. Yes. Okay, great. People can. So I think we can
Okay.
continue with the presentation.
Yeah. So yeah, it's basically an amalgamation of engineering mind and a medical mind, and they're trying to solve problems. You can bring up your own problems of something you want to solve, and maybe you don't have the engineering expertise to solve. So those guys will help you with the technical aspects of it while you give your medical background and medical knowledge. And that's at IIT BETIC, which is called the OrthoCAD lab. And the people there are very friendly. If you approach them with any problems that you think you have a solution to, they'll definitely help you out. And it's definitely something you should consider. Um, if you guys want, I can share. If you just personal chat me on the group or something like that, I definitely share some of the emails that I have of people working there. Okay, so then there's something called the Indian Confederation of Medical Lab Science, which which we move back to lab research, right? So a lot of you may be wanting to do research in genetics or molecular technologies and specific protein pathways and stuff. And this actually gives you opportunities for those. And those are, I honestly think that lab opportunities in good places are really far and few. And therefore, you should, if you are really interested in that, then you should definitely check out ICMLS. So I'm not going to give you an in-depth review because all of you may not be interested in it. So I'm just going to give you a list of basically opportunities that are present, so that you can do your own research and you can see whether it's a good fit for you or not, right? So again, some of the other opportunities that are present are a summer research fellowship program in the Indian Academy of Sciences, where they have a 2-month summer fellowship to help students working with basically scientists that are working on, again, your basically wet experiments where they have labs and genetic analysis, protein pathways, etc. And it's all for all MCI accredited institutions, right? Yes, the 2-month summer fellowship may be a little long for some people, but you can definitely apply for it either during your internship year or even after your internship year. And it may really help you out. Again, there's something called the TIFR Visiting Student Research Program. Again, it's another aspect of your wet lab opportunities that are present. But however, the TIFR program is for people only who are in third year or above. So it's not for the first and second year people. It's for people who have completed at least 2 years of undergraduate education. And also the good point about TIFR is that you get a stipend of 2 months and 40,000 rupees. And they also actually pay for your fare from home to travel to the institute twice. So you can come and then go back whenever your project is over, right? When the 2 months is over. And also the good point about TIFR is that you get a stipend. I'm getting some interference when I'm hearing myself. Is it because someone else's mic is on?
I don't think there should be anyone's mic on. I think someone joined with the student participants link, I guess. I'll just check once again.
Okay. So we spoke a lot about what the other opportunities are where you can work somewhere else and you have to rely on them, either granting you the application or not granting you the application. You have to live in that sort of stress or way, will I get it, will I not get it? And there are always limited opportunities there. So you never know whether you'll have something over there or not. So what I personally feel is that everyone should start their own research, right? And that's the best way to learn. That's the best way to, you're going to make mistakes. Your first paper may not be good enough to publish in a great journal, but that doesn't matter. Even if you don't publish your first paper, if you've just completed that in a systematic way and you followed the research methodology that is recommended in this course and in other courses that are present, then I'm sure that you will not only learn from your mistakes, but you'll also, in the next paper that you do, you will enhance stuff that you already know. And basically, like we say in medicine, that book knowledge is different, and actually having knowledge in the field is completely different, because there'll be a lot of research hurdles that you will face for the first time, and then you'll overcome them, and next time you may not have to face them again, right? So basically, I would definitely recommend you should start your own research. But before you do that, you have to understand a few things. You have to have a basic understanding of research methodology. And by that, I don't mean, what is a cohort study? What is a case control study? What are clinical trials? I mean, that is, that forms the basis of research methodology. However, um, it's not super important for you to learn during your first paper, right? Another thing I would say is that you should definitely keep reading literature that interests you. I think I think tomorrow we're going to have a session on how PubMed searches can be done, and you can get down to reading specific specialties that you like if you like hepatology or if you like renal and stuff like that. So you should definitely keep reading literature, and sometimes you may not understand the stuff that they're doing, but eventually, as your knowledge grows, as you go from first MBBS to final MBBS, your interest will increase in that particular subject because you'll know a lot more about that subject, and therefore it'll make sense to you, right? But being in the habit of reading literature is actually the best way you can not only come up with new studies, but also write your papers well, right? We had an in-depth session about how to write your paper, and it was actually to the point, and it basically identified everything. But nothing can replace you actually reading your literature that interests you, right? And always, before you move on to actually doing your research, you should actually identify a particular research area which excites you. Like, say, if it's orthopedics, or if it's spine surgery, or if it's community health, or anything of that sort. Because once you establish this, you know that most of your research papers and most of your knowledge is going to be based on this, right? Because people see research as a survey sent on Google Forms to your friends or to your medical students saying, please, hey, I'm doing this survey and please answer this. I'm working on a research paper. But that's not actually how research is done in the real world. Yes, those surveys are sometimes important, but they're the lowest level of evidence that are usually available other than case reports. So you should definitely try to identify a particular research area which excites you, and then you try to keep updated with the new papers. Some papers you may not understand, but at least the basics of new papers you'll be able to understand. You'll improve your reading habit. You'll improve your writing habit. You see the way that tables are presented, the way that charts are presented, and you'll definitely have to reflect on how you do it and how you can make it better. You know. And always remember, work with other people in research. This is not a neat fight. This is not MHCT where you have to do better than the other person to be something in life. Um, in fact, a lot of researchers actually work in groups so that they can each contribute to the other research paper, so that eventually the whole group has a huge literature database on a particular subject. So always remember that don't be envious of a person who has 5 research papers in your batch and you have 0. Don't worry about that. Ask him, hey, I'm really interested in research. Like, how did you do this? Next project, can I please work with you or something, right? And if that person says no, fair enough. But I personally feel that you should definitely try to work with other people, because that will not only help you not face the initial troubles that usually amateur researchers face, but also help you increase your research circle instead of a social circle, I would say, where you're gaining inputs from what he's working on, and you're sharing out inputs on what you're working on, and maybe you all are modifying your research questions or research protocols a bit and helping each other out, because it's really not a solo game. And the best way to become an avid researcher is work with other people, because sometimes when you're busy, you can just maybe have a little time to share with them and share on their research, um, because you won't be able to work on your own, because it takes a little time to do your own research, right? So definitely work with other people. Another way that you can, before starting your own research, is that if you want some, sort of expertise or some sort of baseline on how research works, and you're not able to understand it, or you're not able to understand the practicality of it, residents in all medical colleges are constantly working on their thesis, and they will appreciate any and all help that you can give them in terms of like data collection or whatnot. And by that, yes, you will have to do thoda mazduri work, but you'll in the end understand what, because theses are usually vetted by their professors, right? So they can't lose themselves on their methodology. It has to be quite perfect, because the thesis has to be quite rigid in terms of methodology. So you'll understand how research is actually conducted. You'll understand how they are working on it, how you can work on your own research in the future, maybe on a similar topic. Um, and then if that resident say he passes out, if he's not in the second year, he says, "Sir, I have this idea. Can we work on this?" And maybe he, gives you the patient's data. Obviously, this is all after ethics committee approval, but maybe he helps you write your research protocol, something that you're not familiar with, gives it to ethics committee, helps you get the data from patients or whatnot. So that's definitely a great source of a research opportunity that's quite local. You don't have to spend $5,000 for, and can really help you out in terms of understanding the basics, right? Um, yeah, and then you definitely see all the barriers that you have to face in this practical world of research, and you will definitely learn from your mistakes. Sorry for the layout again. Like I said, lose competitiveness and ego. Especially if you both are amateurs, you don't have to fight between मेरे 5 हैं, उसके 4 हैं, उसके तो 3 ही हैं, मैं तो बड़ा हूँ सबसे. No ego. Just work with other people, work with as many people as you can, so that um, you're understanding different aspects of research that they're doing. Maybe you're focused on a particular way of doing research, and they have another methodology in mind. And then you're understanding that methodology from them, instead of reading about it and then suffering from your own mistakes through it. right? And if you do that, you'll not only help yourself get better, but the other person will also benefit from it. So that's why we have formed something called PubGeek, right? And a lot of you may be questioning what exactly PubGeek is. So basically, it's not a derivative of PUBG, right? It's basically derived from PubMed. Um, and what we've basically done is we are trying to connect doctors with students, right? So doctors are people who usually are very like clinical research doctors are usually people who are very busy with their patients, seeing a lot of patients in a day, and they usually don't have enough time to collect data or call up patients and say how you're doing now, or, have rigorous follow-ups for their patients. So and at the same time, students are people who are willing to do anything, not anything, but well, willing to work quite hard to get their research papers with good data published, right? So this is sort of like a collaboration between the two, where you're not only getting to work on research projects that doctors have, but they're also getting something out of you. So it's like a mutually beneficial existence between the two, and that's what we're planning. That's what we're trying to do with this platform. So other than that, there are a few scholarship offerings in India where the Department of Science and Technology, under the central government of India, has a scholarship program for women, which has a grant of 10 to 15,000 a month for 2 years. However, the research project that you're working on has to have the aim of improving the quality of life, or providing additional opportunities for income generation in urban slums or rural areas, right? So if you have a project that's community health oriented, where you are improving the quality of life or somehow increasing the income in urban areas or urban slum areas or rural areas, then you can definitely apply for this scholarship and you know um, definitely get that much stipend for your research and use it for increasing the scale, because 15,000 a month over 2 years is, as we all know, quite a lot. So, like I said, we already spoke about PubGeek, and basically we're basically promoting collaborative research. So as and when we get projects, we update them on our WhatsApp groups and social media pages. Actually, I'm just gonna share a link to the WhatsApp group so you guys, whoever's interested in keeping up with our projects and our workshops and stuff, can definitely join it, right? And yeah. And basically that's what, so we are directly in touch with students and doctors, and that's how we, form a collaboration between them. And it's all free essentially, and it's made for medical students by medical students. So we are trying to, improve research through this platform. A few studies we have conducted so far are, how can one join this PubG group? You can just join through the chat, and you can go to our website. But anyways, a few studies that we've conducted so far using our volunteers is, there was a study on DDH, which is developmental dysplasia of hip, where 4 students were selected to work with researchers from University of British Columbia, right? So they had, in their mind, they had the research idea of studying how basically pediatric orthopedic surgeons treat a patient of DDH, or how they diagnose a patient of DDH. And that's where our students came in, and they actually got I think 500 results, 500 people to answer that very long questionnaire. It was actually 8 to 9 minutes. Yeah, that's what they were able to do. And then they have been mentioned in the acknowledgement section of the paper. And a few other studies that we worked on, but we're also coming very soon with some a COVID related study, which we will share on our groups and stuff. So research opportunities for first and second year are essentially try to get your hands on any sort of volunteer experience, whether it is with your residents in your college or through a platform like PubGeek, or if you know anyone who's in research, whether you're having a lab, a wet lab sort of experience, where we spoke about tons of research opportunities there. And that's honestly, first and second, I would really recommend to work on your research basics in the start, so that when you're in the third and fourth year, you can really focus on, as you get more knowledge of clinical stuff, like like ENT, ophthalmology, PSM and stuff. So then you'll understand how research would actually help those subjects and how you're actually going to change the way maybe your doctor treats a patient or something. And that's when you should really get into your research, because otherwise I've seen a lot of people publish case reports on how a radial artery is deviating from its normal course in one cadaver on some dissection table, and the recommendation that they've given is we should be careful while doing surgery, that this radial artery can be here also. But that's obviously not right, because it's a very rare anomaly, and you can't present that as like a sort of research situation. So again, BPTH also, the lot of the opportunities that we spoke about are basically for bachelors, people who are in their bachelor's degree in any medical sort of biomedical field. So you can definitely use this, use that. STS cannot be done in a group. Yes, it's not. It cannot be done in a group. It's an individual project. You have to work with a guide. But I'm saying that if you are working on your own project that's not STS, then you can have someone else work with you, right? So definitely follow us. Scan this QR code for WhatsApp group. Uh, keep in touch with everything that we actually have to offer. Yes, we have. So we are working on expanding to a few other places like Chhattisgarh, where we recently had a workshop with 1,400 people, and we're trying to expand that. We're trying to get more doctors on board where we can give you research opportunities. The issue with that right now is not a lot of doctors are working in their private practice very with without any conditions. So just the strict entry of a student would cause alarm during this COVID situation. So maybe not for the next few months, but definitely after that, we're working on these things, and we'll have updates ready for you as if you guys are following our social media channels. Thank you guys. If you have any questions about any research opportunities or something associated with the same, I'd be happy to answer it.
So thank you so much, Dr. Aniruddh.
Thank you.
I believe you have covered most of the questions by yourself, so I think there wouldn't be a need of a very formal Q&A session again. But if you want, we can take a few.
No, there don't seem to be any questions. You can move on to the next speaker because we're running out of
Okay,
time
fair
now
enough.
anyways.
Okay.
ठीक है, चलो. Thank you guys then. See you on a public platform, or see you with the workshop tomorrow. Hopefully I'll be able to join. Take care.